Welcome to Dr. Balga's podcast for the Curious Doc. Today is June 10, 2026. This video is on an ACC, AHA, ADA, ASN guideline for the prevention, detection, evaluation, and management of cardiovascular kidney metabolic syndrome or CKM syndrome. Published online, free access, yesterday on 9 June 2026. Hot off the press. What is CKM syndrome? It's a systemic disorder linking obesity, diabetes, chronic kidney disease, and cardiovascular disease. Why was this guideline developed? To provide integrated prevention, detection, evaluation, and management of CKM syndrome. Who should be assessed for CKM syndrome? Both youth and adults across the life course. What is the goal of CKM staging? Prevent progression, promote regression, and personalized therapy. Why is CKM important? It increases risks of cardiovascular events, kidney failure, and death. What defines CKM stage 0? Normal weight, glucose, blood pressure, lipids, kidney function, and no CVD. CKM stage 1 is excess or dysfunctional adiposity, including overweight, obesity, or prediabetes. CKM stage 2, metabolic risk factors, chronic kidney disease, or both. What defines CKM stage 3? Subclinical cardiovascular disease or very high CKM risk. What defines CKM stage 4? Clinical cardiovascular disease with CKM risk factors. Why measure waist circumference? It identifies abdominal adiposity and refines cardiometabolic risk assessment. What is the BMI threshold? What BMI threshold indicates stage 1 in Asians? BMI equal to or greater than 23 kilos per square meter. How is prediabetes defined? A fasting glucose of 100 to 125 milligrams per deciliter, or hemoglobin A1C from 5.7 to 6.4%. What is metabolic syndrome? It's a cluster of obesity, dyslipidemia, high blood pressure, and abnormal glucose metabolism. Why focus on adiposity? Excess adiposity is a major driver of CKM progression. How is CKD assessed? Using EGFR and urine albumin to creatinine ratio. Why measure UACR? It detects albuminuria and improves kidney risk stratification. What defines CKD? Reduced EGFR or albuminuria persisting for greater than 3 months. Why screen routinely for CKD? Early detection enables kidney and cardiovascular protective therapies. What is kidney failure? EGFR less than 15 mL per minute for 1.73 square meter body surface area, or the need for chronic dialysis. What is PREVENT? It's a risk calculator estimating atherosclerotic cardiovascular disease, heart failure, and total cardiovascular disease risk. Why use PREVENT equations? They help to stage CKM syndrome and guide treatment intensity. What 10-year CVD risk suggests stage 3? PREVENT estimated risk greater than 20%. When can coronary artery calcium scoring help? When preventive treatment decision remains uncertain. What coronary artery calcium score indicates subclinical atherosclerosis? An Axton score of greater than or equal to 100. What is pre-heart failure? Structural, biomarker, or functional cardiac abnormalities without heart failure symptoms. Which biomarkers help to identify pre-heart failure? BNP, NT-proBNP, and high-sensitivity troponins. Why identify pre-heart failure? To initiate prevention before symptomatic heart failure develops. How often should risk factors be assessed? Longitudinal reassessment is recommended across CKM stages. Why is early diagnosis important? Many CKM conditions are asymptomatic. Why assess social determinants of health? They strongly influence CKM risk and outcomes. What is interdisciplinary CKM care? Coordinated management across specialties and care settings. Why have a CKM coordination point person? To improve implementation of evidence-based care. What lifestyle framework is emphasized? Life's Essential 8 and healthy behavior change. How does physical activity help? It improves weight, metabolic health, and cardiovascular outcomes. What is the cornerstone of stage 1 treatment? Intensive lifestyle modification and weight loss. When is obesity pharmacotherapy appropriate? When lifestyle measures alone are insufficient. What role does bariatric surgery play? It promotes substantial and durable weight loss. Why manage weight aggressively? Weight loss can improve or reverse progression of CKM. What should occur after gestational diabetes? Intensified screening for future diabetes and CKM risk. Which glucose-lowering drugs provide cardiovascular benefit? SGLT2 inhibitors and GLP-1 based therapies. How should type 2 diabetes therapy be individualized? According to CKD, atherosclerotic cardiovascular disease, heart failure, obesity, and metabolic needs. Why are SGLT2 inhibitors important? They improve cardiovascular and kidney outcomes. When should GLP-1 based therapy be considered? For obesity, diabetes, atherosclerotic cardiovascular disease risk, and chronic kidney metabolic management. What's the role of RAS inhibitors? They lower blood pressure, reduce proteinuria, and protect both the kidneys and the heart. What therapy is recommended for persistent albuminuria and type 2 diabetes? Addition of a non-steroidal MRA or a GLP-1 based therapy. How is hypertension addressed in CKM? Through guideline-directed blood pressure management. Why treat hypertriglyceridemia? Because it contributes to cardiometabolic risk. How is atherosclerotic cardiovascular disease managed in CKM? By integrating obesity, diabetes, kidney, and cardiovascular therapy. How is heart failure managed in CKM? Using guideline-directed therapies with cardiovascular and kidney protection. This is a fantastic document on CKM. Read this very important document. This is an infographic of this guideline document. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.